you everybody for attending our Heal Venture Lab podcast. Here we have Dr. Timothy Low, who is a EVP of a QuickBot and a board of director of healthcare services. Dr. Tim, good to have you here.
Thank you, Jaemin. I'm glad to be able to be on your podcast and contribute some of my thinking and sharing through my experience.
Hey, thank you very much. So, Dr. Tim, we definitely want to, I guess, pick some on your previous experience as a CEO of the Fair Park Hospital. I'm sure where you saw a lot of cutting edge trends in the medical tourism in Singapore. But before that, of course, we like to start with your personal background. You also have a very interesting background. You studied in medicine and then moved into industry with the Covidian and Medtronic before, I guess, going into the CEO of a hospital. So maybe you can kind of describe your personal journey first, and then I think you can share a bit about your day-to-day hospital experience. Yeah.
Yeah, sure, Jaemin. Just let me share with you and the group. I would say that my healthcare journey has evolved across several different chapters. If I may put, it's like a book that I wrote. Actually, I wrote two books, which is something on management and leadership that's called The Triangulation of Success. And then subsequently, like last month, I wrote and published another book that's called Patching Up Wellness, which is about phototherapy and the science behind phototherapy and why do we need light and why do we need it now. So anyway, these several chapters that I would like to share is that, I started off as a medical doctor. And so my first lens has always been the patient. This is very important because even when I later moved into hospital leadership, into investment, into AI, into robotics and wellness, the patient never left the center of my thinking. Now from there, I moved into hospital leadership, serving as CEO of major private hospitals in Singapore, Gleneagles Hospital and subsequently Farrer Park Hospital. And that gave me a very different perspective. I began to see healthcare not just as clinical treatment, but as an entire ecosystem of trust, of service, of operations, of culture and technology, and as well as human emotion. And later, I moved into healthcare investment, which is something that we are not taught in medical school, where I had the opportunity to evaluate medical technology, digital health, AI, and the new care models from a strategic and financial perspective. And today, my work sits at the intersection of healthcare, AI, robotics, longevity, regenerative wellness, medical tourism, and borderless healthcare. So I often say I have not left medicine. I have widened the definition of medicine. And because, healthcare today is no longer only about hospitals. It is about prevention. It is about access. It is about intelligence. It is about logistics, education, wellness, and trust. And of course, helping people live not just longer, but live better. Right. So a little bit about my background, personal healthcare journey. My journey began as a clinician, and that clinical foundation is important. And it's because medicine touches your humility. Patients do not come to us as case studies. They come with fear, they come with hope. They come with their families, they come with stories, and they come with trust. And as a doctor, I'm a medical doctor. As a doctor, you learn very quickly that healthcare is deeply human. And you may have the best diagnosis, the best treatment plan, and the best technology. But if the patient does not feel heard, does not feel that they are reassured, and does not feel that they are guided, the care experience is incomplete. And that belief followed me throughout my whole entire career. So when
Mm,
I moved from clinical practice
mm,
into the hospital leadership, I began to appreciate the complexity behind every patient experience. A hospital, as you know, is one of the most complicated organizations to run.
mm.
I've not run hospitals before, and oh my gosh. The first time when I ran Gleneagles, it was my first hospital.
Wow.
Oh, it's a handful
Mm,
and it's mindful. So it never sleeps. The hospital never sleeps. It deals with life, death, anxiety, families, regulators, the Ministry of Health, doctors, nurses, operations, finance, technology, and service quality all at once.
mm,
So being a hospital CEO taught me that healthcare leadership is not just about strategy.
mm,
It is about presence, to be present there. It is about clarity. It is about making sure that the entire organization remembers why it exists. And that is the reason why I try my best. And that reason is always the patient.
mm,
So just to share with you the experience as a hospital CEO, whether it's myself or I think any other hospital CEOs that are running hospitals, right? Being a hospital CEO was one of the most and best leadership classrooms of my
mm.
life. Yeah, it is a classroom indeed. Yeah. A hospital is not just a building with doctors and nurses.
Of
It is
course.
a living organism, as I can put it. And every decision affects someone's life,
Mm,
someone's family, and someone's trust. Trust, I find that it is something that is difficult to build, but
mm,
easy to lose. And as a CEO, I learned that excellence in healthcare is not only clinical, it is emotional. A patient may not fully understand the complexity of their condition
mm,
or their treatment that the doctor is prescribing, but they will remember how they were spoken to, whether they were reassured, whether the family was updated,
mm,
and whether the system felt human. And so that shaped my leadership philosophy deeply as I ran hospitals as an organization. So in
mm.
healthcare, you will find that efficiency without empathy becomes cold. Empathy without execution becomes chaos.
That's true.
Yeah. So the real art is to combine the both of them.
Mm,
So this is where healthcare leadership is different from many other industries. In healthcare, trust is not a slogan. Trust is an operating system in healthcare. So patients trust us with their
mm,
bodies, they trust us with their fears and their families and sometimes their final hopes.
mm,
So hospital leadership must combine clinical governance, service excellence, operational discipline,
mm.
and most important, compassion. Yeah. So I also learned that innovation must solve real problems
Mm,
in hospital, right? So technology, as you know, for the sake of technology, it rarely works in healthcare. But when technology improves safety, technology improves speed, technology improves communication, it improves diagnosis. When
Mm,
technology improves recovery, access of patient confidence, then it becomes meaningful.
mm.
Mm. So that is why I always say innovation must have a human purpose.
So maybe going back to your experience working as a CEO, right? Like where did you what were some of the what were some of the, I think, challenges you saw on the ground? I mean, you mentioned about compassion. Of course, I think that's something that will still be learning for a lot of new CEOs that's going to be coming up, right? And they have
Right.
to learn that patient, compassion, and connecting with the patients, I guess, is the ultimate goal. But then you get buried in the P&L and all the things that come, so you kind of sometimes miss that, right? So how did you manage to balance that? And what were some of the good experiences? Let's say, maybe some specific instances where you had some really happy achievement, and also maybe some days where you had some a really kind of like a sad or disappointing experience, which you kind of I'm sure you used for the better things in the future. So maybe you can share some of their personal experiences. Yeah,
Right. So being a hospital CEO does not mean just the bottom line,
of
the
course, of course.
P&L. I mean, that's important, of course.
Mm,
But people, managing people, managing the expectations, managing your customers. We have actually in private hospitals, we have three sets of customers.
mm,
One is the specialists, doctors,
mm.
and the specialist doctors has their patients. That's the second set of customers.
Mm,
The third set of customers is your internal customers, your staff, your
mm,
nurses, your ancillary staff. And so, to have a good patient experience, a good patient journey through the hospital, you need to ensure that your staff is motivated. If your staff is not motivated enough to provide the empathy, to provide the service excellence that is so needed in hospitals and so needed, especially in private hospitals, then the whole organization will lose its effectiveness and the attractiveness for patients to
mm,
come, right? So motivation of staff, engagement of the specialist doctors so that their needs are being met,
mm,
and to ensure that we have patients' needs and preferences being looked into. And actually, before they come in, we
mm,
also, if they are repeat patients, we also have their present preferences that is locked into the system so that we know what their needs are, what their idiosyncrasies are. Like some patients do not like noise. So we must make sure that when we put patients into the ward,
mm.
we try our best to put them in a place where it's not noisy. Sometimes, near the kitchen or pantry, there are definitely noise. Some
Yes.
patients can take it. I mean, they can sleep with noise, and some patients cannot take it,
Mm,
and that's where complaints come. So you need your own staff to be able to be um, very customer oriented,
mm,
and you need a hospital system that can capture patient preferences. And you need, of course, a collaboration with the your specialist doctors, our specialist doctors. Yeah. Um, so what I did in terms of motivation of staff, I brought in programs from the US. Let's
mm,
say fish philosophy. Fish philosophy is a philosophy that the fishmongers, for example, in Pike
mm,
Place Fish Market in Seattle,
mm,
they have four philosophies, in Seattle. Pike Place Fish Market.
mm,
One choose your attitude. 2, play with your customers. 3, be there, be your presence, be there. And 4, very simple, make their day, make your customers' day. So with this philosophy, I brought the author of the book Fish, Fish, who wrote about fish philosophy into the hospital, trained my staff in terms of choosing your attitude, in terms of playing with your customers with a purpose, in terms of being there with your customers, and lastly, make your customers stay. So this has helped motivate the staff and help them change their behavior towards hospital and healthcare service excellence. So these are some of the things that I've done in terms of staff motivation, patient engagement, and of course, doctor collaboration.
I think a staff retention is a universal problem in every country. But of course, you also mentioned about the specialist. I guess how to manage a specialist. What are some of the challenges that you see working with a specialist? Yeah.
Yeah, the specialists are not under our payroll, especially in the private hospital. They are actually having their own clinic and doing their own professional services.
Yes.
And giving it to their patients. What the hospital provides is the hospital beds, the wards, the operating theater, the diagnostics, the laboratory. These are services that we provide. So we must make sure that the doctor's needs are being looked into so that we facilitate their care for their patients, which are our customers too.
True.
So if we cannot give the doctor what they want, then we need to make sure that there is a compromise or alternative that we can offer them. Take, for example, if the doctor says, I need to operate on this patient because it's a foreign patient, the patient has flown in, and the patient is only 1 to 2 days time and they need to fly out. But the operating theater is full. In terms of all the slots are full. And operating theater finishes normal days like 6 p.m. So what can we do? We will make sure that we have another team of nurses that's being called back. We offer nighttime slots for the doctors to be able to do their operation. And, their patients can be operated on that day itself, perhaps in the night. And, recuperate the next day and then fly out. So in terms of flexibility and compromise and alternatives, we need to make sure that we provide doctors and their patients that kind of service. And for the staff to be able to call back and still be motivated, that's why I said we need to motivate staff and make sure that they're being cared for, that their voices are being heard, their lives are being looked into, their daily lives are being looked into.
There's a lot of things to cover as a CEO of the hospital.
Well, it's a good balance that we need to play. But what's most important is that you need a very good team to execute. Just having a good strategy, just having a good management culture, management style is not enough. You need to make sure that the whole organization has a culture where I built a culture of caring and sharing, the caring and sharing culture, so that your C-suite teams, your senior managers, your directors, they can execute according to culture, according to strategy, according to plan. It's just like investing. If you're investing in a new startup, you'll be looking at whether the team is a good team, whether they can execute.
Oh, yeah. That's a big chunk of the thesis.
Yeah. Execution is key.
Yes. Oh. Okay. So I think it's good to get some, I guess, insights from your experience. I'm sure you saw a lot of them. I mean, you were at the forefront, right? I mean, as a Farrer Park CEO, you probably saw a lot of medical tourists. What have you seen during your time? Yeah.
Yeah, just okay. Medical tourism is another area where private hospitals need to make sure that they're on top of it. So let me share with you medical tourism then at that time.
Yeah, sure, please.
Yeah. So when I was leading private hospitals and medical tourism was largely about access, patient access, the reputation of the hospital, and the trust that's being built.
Mm,
Patients, they traveled because they wanted a trusted specialist,
mm,
faster access,
mm,
better facilities,
mm,
clearer diagnosis, or treatment that was not easily available in their own home country. So
mm,
Singapore had a strong position then because of the clinical quality, governance, safety, transparency, and trust.
mm,
And for many regional patients, Singapore represented reassurance.
mm,
Mm. So medical tourism then was often treatment driven. For example, cancer care, cardiology, orthopedics, fertility,
mm,
health screening, the higher level health screening, complex surgery, not the everyday simple surgery, but complex surgery.
mm.
The hospital was the destination. The doctor was the anchor.
Right.
And the concierge function, the medical concierge function, was important, but the model was still largely built around illness and intervention. So
Mm,
patients travel because something was already wrong or
mm,
because they wanted confirmation, which is like second opinion, that
right.
nothing serious had been missed. So if you look at medical tourism now,
Yes.
today medical tourism has changed dramatically, as you know.
Mm,
Patients, they are more informed. They compare doctors, they compare outcomes, they compare price, which is one of the main areas, right? Singapore dollar is
uh.
so strong. So
But they didn't do that before. They didn't. I'm sure they compared price before back then also.
yeah, they compared price before.
Mm,
But now they compare price even more.
mm,
Yeah. And of course, access,
mm,
waiting time, digital reviews, service quality, and the overall experience.
mm,
This is the kind of patients now. And they are no longer passive medical travelers. They are
mm.
actually healthcare consumers. The region has also become much more competitive, right?
Yes, yes.
With Malaysia, with Thailand. So
Mm,
different countries, they now play a different role.
mm-hmm.
Yeah, some compete on price,
Yes.
some compete on hospitality,
Mm-hmm.
some will compete on aesthetics,
Yes.
and some will compete on complex care.
Mm,
So Singapore must continue to compete on trust, governance,
mm,
specialist depth of knowledge and depth of experience,
mm,
safety, and the premium care that we can give from Singapore.
mm,
So this is the biggest shift that I see. Medical tourism is moving from sick care travel to health optimization travel. So people are no longer traveling only when they are ill. We find that they are traveling now for prevention, for
mm.
diagnostics, for longevity, which is coming on very quickly. Yeah.
Yes.
For recovery, for fertility, for aesthetics. And now we find they're traveling for regenerative wellness, performance, and they're traveling for peace of mind also. Yeah. So the old question was, where should I go for treatment?
Mm.
But now the new question is, where should I go to understand my body better? Where should I go to understand age better, recovery better, and live better? These are the questions that people ask nowadays. And that is very important. It is a major shift. It means that medical tourism
Mm.
and wellness tourism, they are actually converging.
Yes, yes.
Yeah. And this is where the future opportunity lies. From healthcare to well care. I increasingly use the term well care
Mm.
because in hospital it's called sick care. So in healthcare, traditionally we treat disease.
Just going into just back a little bit. So before when you were the CEO and then the medical tourism at the time was more sick care, right?
Yes.
Where did the patient profile change before, during your time, and now with I guess the paradigm shifting more toward well care and kind of a holistic, like almost like preventive care? Did the patient profile change for Singapore? And we've also seen some rise in neighboring countries with their medical tourism. So what have you seen so far there?
Yes. After COVID,
Mm,
we see a shift. We see a great change in mindset and behavior.
mm,
Because during COVID, the 3 years of COVID, people cannot leave their country, or most people cannot leave their country unless it's very, very dire, urgent.
right.
Otherwise, they cannot leave the country. And so during COVID time, they are looking for their own specialist care within their own country. And
Mm,
most people have found over the 3 years whatever specialist or whoever specialist is needed to treat their normal conditions or conditions that can be treated within the country itself. Now, after COVID, it has not changed in terms of their behavior and mindset. Their usual conditions, which they come out to Singapore to be treated or come out
mm,
of their country, now is being treated in their own country. Only when it's serious, only when it's complicated, only when it's complex cases like, oncology, difficult oncology cases, difficult cardiac cases, difficult orthopedic cases, or robotic surgery that's being needed, then they would come out of their country for those higher level treatment or more or complexity. And with that, people are looking at health span.
mm,
And with health span, they want to make sure that they keep their health in the wellness state longer so that
mm.
they avoid getting into the hospital sooner. So, well care will prevent people from sick care until towards the last stage of their life. So it's a mindset change, and then mindset change follows a behavioral but the behavioral change follows a mindset change. So that's a behavior in terms of looking for prevention, looking for preventive, looking for early prognostic, predictive um, diagnosis, predictive screening, so that they can look into any potential conditions earlier. So that's the change in terms of mindset and behavior.
So the different countries, I mean, so like it's shifting toward the more this prevention and wellness and interest in health span, right? So that
Mhm.
means the type of services that you're going to offer at the hospital will also change. Are we in Singapore equipped to compete with, let's say, like a Thailand and Malaysia. I mean, maybe they're not as good as Singapore when it comes to like, okay, depending on specialties. But in general, Singapore still has a dominance in terms of like more complex, I guess. If you're really sick, you still come to Singapore. But in these areas, I don't know how competitive we are compared to the neighbors.
Yes, so we are expensive because our dollar is high in terms of comparing the exchange rate with Indonesia, exchange rate with the Indonesia rupiah, exchange rate with the Malaysian ringgit, and exchange rate with the Thai baht, for example. Even the Philippines peso.
Yes, yes.
It's pretty expensive for these people coming from these countries.
Mm.
So that's why they choose only complex cases or higher level cases that needs complex um, techniques or robotics
Mm.
or something that their country cannot provide them in terms of a clearer and more definitive uh, diagnosis and treatment. Yeah.
Mm.
So that's why we see the change. And that's one area that I wanted to share is that I'm increasingly passionate about borderless healthcare
Mm.
because the countries are around, but
Yeah.
we want to make sure that they are borderless.
Mm.
So to me, the future of healthcare is no longer confined by the walls of a hospital or the location of a specialist or even
Mm.
the country where these patients live. We're moving into a world whereby there's healthcare knowledge,
Mm.
consultation, education, healthcare education, monitoring and care coordination. They can flow through the cloud. That is very powerful.
Mm.
And in the past, the hospital was the center of care.
Mm.
Today, the patient must become the center of care. No more the hospital. It's the patient is the center of care. So the clinic of the future, the hospital of the future, and the hospital at home is a new term that these are models that will all be interconnected through digital platforms,
Mm.
telemedicine, AI, remote monitoring, robotics, logistics, and cloud-based medical knowledge.
Mm.
This is where healthcare and well-care will converge.
Mm.
As you were saying, people are going to well-care, right? So
Yes.
when both are connected through a knowledge-based ecosystem
Mm.
in the cloud, we can support patients before, during, and after their illness. So imagine a patient in Indonesia, for example, they may not need to travel immediately to Singapore just to
Mm.
get a first opinion,
Yes.
right? Their records, their imaging, their history, and the questions can be reviewed through a trusted cloud-based medical network. Specialists can advise from
Mm.
wherever they are,
Mm.
whether the specialists are in Singapore or Australia or wherever the specialists are.
Mm.
The specialists can even be in the US,
Yes.
right? Only the time difference. Yeah.
Yeah.
So local doctors in their own country can be the ones supporting the patient.
Mm.
Families can understand options earlier, as if travel is needed, and if the travel is needed, it becomes more purposeful for the patient,
Mm.
and becomes more coordinated, better coordinated. Now, this is not simply telemedicine, which
Mm.
we find that it has been escalating since COVID time. It's
Mm.
not simply telemedicine. It is knowledge mobility. It means expertise can move before the patient moves. Patient stays in their country, expertise can move. And that to me is the real promise of borderless healthcare. The
Mm.
future of healthcare is not just borderless travel. It is borderless knowledge.
So, I mean, how far are we in that, I mean, borderless healthcare, I think that's the direction we're definitely moving to, right? But I guess in order for us to achieve that, of course, we need some kind of a platform to connect, right? Different places, right? Get patients access to different providers. But also, I think even maybe the hospitals may need a partnership with other countries, maybe have some kind of a tie-up, right? How do we bring all this together?
Yes. As long as there's a cloud of knowledge that we can provide and a very safe digital platform,
Hmm.
we can connect patient to doctor to specialists to even different specialists from different countries. We can connect the best right into the patient and the doctor who is taking care of that patient in their own country. Yeah. So this is interconnected, borderless healthcare of the future. It is something that we need to embrace because number one, it saves money, it saves time, and if you need treatment outside, then you fly out, and already you have identified who you want to fly to because you would have assessed the doctor that you're speaking with or the specialist that you're speaking with, and it's all done through the cloud. So I guess that is something which I'll call clinic of the future. The clinic of the future will not just be a place where people go when they feel unwell. It will be an intelligent front door
Mm.
to health. A clinic of
Mm.
the future should educate, it should
Mm.
guide, it should risk stratify, it should connect to specialists. The clinic of the future should monitor patients over time. It should
Mm.
support their lifestyle, their prevention,
Mm.
and early intervention, of course. And many neighborhood clinics are trusted by patients. The GP clinics, they're
Yeah.
trusted by patients, but they may not always have immediate access to very deep specialist expertise or the advanced technologies.
Mm.
So through a cloud-based ecosystem, clinicians can become more powerful. They
Mm.
can connect to expert networks, whether it's expert in fertility or expert in neuro modulation or cardiac. They can access decision support. They can refer more intelligently. They can follow up more effectively. And so that is how we strengthen the primary care
Mm.
in their country without overwhelming the hospitals. And the future clinic is not small because it is local. It becomes powerful because it is connected.
Mm. Was this I guess, is this why you started going into the Ask Dr. Tim, the platform? I mean, I don't know. Is that why you went into that?
Yeah, the Ask Dr. Tim AI
Yes, yes, yes.
is actually launched like last week. All
Oh,
right.
yes, yes.
Okay, the exact date was 27 May.
Oh, wow. Very recent.
Why? It was because it's a good day.
Yes.
So anyway, Ask Dr. Tim AI. If you want to access, it's www.askdrtim, as in
Mm. Mm.
ASKDRTIN.ai. So
Oh, okay.
yeah, so this is a platform that is built with AI,
Mm.
and of course, I train the AI.
Yes.
The AI needs to be trained, otherwise they will hallucinate. So within a trained AI environment,
Yes.
it is not going to hallucinate.
Mm.
And that will answer questions on phototherapy. Phototherapy is light therapy.
Mm.
Yeah, it's light therapy that is being used for our wellness and health. I get a lot of questions, people asking me morning, night. they ask me questions about phototherapy and the patches that is being used. The patches are called LifeWave. It's a phototherapy patch that will help in many conditions
Mm,
adjunctively. Yeah, not it, LifeWave phototherapy patches. They are not meant to diagnose, treat, or cure. Right? It is an adjunctive complementary approach.
mm.
So people do not understand what is phototherapy. People do not understand how to use the patches. People do not understand where to patch the patches for their conditions.
It's a patch. What do you mean by a patch? Is it or how does it work?
Okay, a patch. Okay, let me show you the patch.
Oh, you have one on your shelf.
I have it on my uh behind my neck.
Ah, okay. So that's a. But how does it work as a phototherapy?
Yeah. So this is a patch.
Yes, yes. I see. Yeah.
It's a small patch. It's about 50 cent coin patch,
Yes.
size of a patch. How does it work as a phototherapy?
Mm,
There are 10 different patches for different uh, needs. All right. So one of the patch is called X39. This patch will increase a tripeptide in our body, which
mm.
is GHK copper, glycine, histidine, and lysine copper, a tripeptide copper. This patch increases the level of GHK copper. And
Ah.
the GHK copper in our body will activate our stem cells, our own body's stem cell,
Mm.
increases the stem cell activity within our body. So it is not a drug, it is not a chemical, it is just a patch that gets activated by our own body heat. Because our body heat is infrared. We emit infrared heat.
Right.
If during COVID, you see, when you get out of a plane, when you walk out of a plane, you see cameras, right?
Yes.
And these cameras will actually show whether you're red or blue. If you're red, means you're having fever.
Mm.
If you're blue, you're okay. So our body emits light. So this light, infrared light from our body, hits the patch, gets reflected back into our body in a different frequency.
Ah,
Uh,
okay.
so it is not drug. So this different frequency will go about photobiomodulation in our body
Mm.
and does its work. So it increases our activity of our stem cells. It helps in regeneration. It helps in healing. It helps in many things.
That's very interesting. When I heard of phototherapy, I was thinking some kind of a lamp, or I don't know, but this is actually a new concept. I haven't actually heard about this before.
Yeah, this is actually new in Asia,
Hmm.
but not new in the US. It has been in the US since 2004. So that's about more than
Oh
20
wow.
years ago.
Wow. They come up with a very interesting. So this is I guess something that people can use without prescription, and they can just put it on themselves.
Yeah, yeah. This is you can use without prescription because it is not a drug. So, it is phototherapy patch that is patched on certain acupoints
Hmm.
and certain meridian lines. It is a US technology,
Hmm.
but combined with acupoints. So it's like combined with the traditional Chinese medicine
Hmm.
approach.
Hmm.
Yeah. So it can be considered as needleless acupuncture
Oh wow,
because
that's
there's
very
no
nice.
needle.
Yeah,
It's only a sticker.
yeah.
Yeah,
That's a very revolutionary concept. If they can replace the needle in acupuncture, that'll be a very big, yeah.
that's right. That's why
So,
I'm always
yeah.
interested in innovation
Mm.
and world's first innovation that helps the human body.
So on that note, what got you involved with the QuickBot? I mean, QuickBot is a different kind of innovation, right? But what interested you with the QuickBot, and how does it impact the healthcare?
All right. So at QuickBot, I serve as the Executive Vice President for Healthcare Services.
Mm,
I see that as an important piece of the future
mm,
because healthcare is not only about knowledge flow that we
mm,
were talking earlier on about.
mm,
It is also about physical flow. What I mean by that is that medicines must move, specimens must move,
mm,
medical supplies must move,
mm,
food, linen, equipment, and documents must move. And in hospitals, much of the movement still depends on human manpower.
yes.
And this creates inefficiency, delays, and unnecessary workload. So the agentic AI in QuickBot, it's a platform, agentic AI platform, controls the robots. The robots is just a tool, right? They can transform a lot of tasks into autonomous logistic delivery
Mm,
for the hospital. So autonomous last mile delivery in healthcare can support hospitals, clinics, laboratories, and even hospital at home models that we were speaking about. So you
mm,
just imagine a hospital where robots, they can coordinate internal delivery. Specimens move safely and quickly. Medicines will reach the right ward.
mm,
Supplies are delivered and traceable because
mm,
the agentic AI can trace and document, keeps the data.
mm.
Nurses will then spend less time chasing items and they and they can spend more time caring for the patients, which
Yes.
all of us need, right? So that is not science fiction.
Mm,
That is the future of hospital operations. The important thing is not robotics or robots replacing humans. It is
mm,
robots taking over repetitive movement so that people can focus on high value human care.
mm,
And AI can move knowledge. Robots can move things. Healthcare leaders must move trust. And that is the integration that I see.
mm.
Digital intelligence plus the physical intelligence plus human compassion. That is the future of healthcare. And that's why I am in QuickBot.
Before when I was doing med school or like if this was like maybe I don't know 10 plus 20 like years ago, right? Of course, people are talking about empathy and compassion, but I think with this rise of AI and all these robotics, so I think the meaning of this is even more profound now. I mean, it's even more critical because it can really become very mechanical, right? With
Yeah, that's
I
right.
mean soon. Uh,
AI in healthcare leadership, if you see, AI is now becoming unavoidable in
right.
healthcare, right?
Yes.
But I think we must be careful how we frame this because AI should not be seen as a magic wand, in like Harry Potter. It is not here to replace clinical judgment. It is
Mm,
not here to replace empathy.
mm,
It is not here to replace the doctor-patient relationship that
mm,
is so much needed, right? AI is best seen as a decision support partner, a pattern recognition tool,
mhm,
and a way to reduce cognitive and administrative burden. So in healthcare, what I see is that AI can help with triage, imaging analysis, X-ray, MRI imaging analysis, predictive risk, workflow optimization, patient education, documentation, logistics, and
mm,
personalized care planning. AI can do all that, but the human role still remains essential. So
mm,
AI can process information, but clinicians must process the meaning. AI can suggest, but humans must decide. AI can scale access, but humans must preserve the trust. So the future of healthcare leader must understand both sides of this, and we must be technologically curious, but ethically grounded. So we must be innovative, but clinically responsible.
I mean, I think like when we study this topic when we were younger, right? You
Mm-hmm.
sometimes kind of want to overlook because like we want to focus on, I guess, like the technical details or like I mean different things, right? But
Mm-hmm.
then as you become a leader and then as you go, into your career, I think the value of compassion and all these ethics is really becomes, I guess, even more, I guess, important. So I guess you can see this value as your career progresses. And I guess with what's happening nowadays with the AI and robotics, I think it's really important. Yeah. And of course, with the medical tourism, I mean, like we also have to kind of figure out how to balance all these different, I guess, topics and how to really, I think, make it really, I guess, a better environment for the patients. Yeah.
That's right. That's right. Yeah. In medical tourism, you need to consider the trend
Hmm.
because trend has changed, trend is changing, and what I see is that the longevity and wellness trend
Hmm.
is changing,
Hmm.
especially for medical tourism also. My thinking on longevity
Hmm.
has evolved over time.
Hmm.
Previously, even before COVID, not many people were thinking that much about longevity.
Hmm.
But after COVID, a lot of people are starting to think about that. So in the past, longevity was often marketed as anti-aging.
Yes.
But I think that language is too narrow. Longevity is not about refusing to age. It is about aging with function, dignity, energy, cognition, mobility, and purpose. So
Hmm.
living to 100 is not impressive
Yes.
if the last 20 years are spent in frailty,
Yeah.
in loneliness and
Yes.
pain, or it's based, on dependence on somebody.
Hmm.
And, that's terrible. So the real goal is not lifespan alone. It is health span, as we were talking earlier on. To me,
Yes.
longevity has five important pillars.
Hmm.
First is cellular health, health of our cells.
Hmm.
Second, metabolic health.
Hmm.
Third, muscle and mobility.
Hmm.
Fourth, the brain and emotional resilience.
Hmm.
And the last, fifth, is purpose and connection. So technology will play a major role, like wearables, like AI, like biomarkers, body composition tracking, genomics,
Hmm.
microbiome testing, phototherapy, regenerative wellness, remote monitoring, but we must not forget the basics. Sleep. Sleep is
Yeah.
medicine.
Yes, yes,
Movement is
yes.
medicine. We need to
Mm,
move. We need to exercise, right?
mm,
Nutrition is medicine. Sunlight is medicine. That's why also, sunlight is also photo, right? Light,
yes, yes.
right? Relationships are medicine.
Mm,
Purpose is medicine. Longevity should not become a playground only for the wealthy or the
yes,
anxious. Yeah.
yes,
It should become a practical framework for helping people live better, live longer. And the future of longevity is not just biohacking. If you heard of
yes.
the word biohacking,
Yeah.
future of longevity is not just biohacking. It is
Mm,
biology plus behavior
mm,
plus belief. So I see several major wellness trends emerging now.
mm-hmm.
Firstly, wellness is becoming data driven.
Yes.
People want to track their sleep, want to track their HRV,
Mm,
heart rate variability. HRV, the new kind of like
yeah.
the buzzword, right?
Mm,
They track their glucose. Sometimes you see them patching the glucose monitoring patch.
yeah.
Body composition, inflammation, biological age, and recovery. And secondly, wellness is becoming personalized.
Mm,
That's why you were asking me earlier on, when people are coming as
Yeah.
medical tourism, as a medical tourist, medical tourism for wellness is becoming personalized. The one size fits all approach is fading away. Yeah. People want advice tailored to their biology, their lifestyle, risks, and goals. Thirdly, wellness is becoming preventive. People do not want to wait for disease before taking action.
Mm.
And fourthly, wellness is becoming experiential. The future of health destination where they're traveling, right, will not feel like a cold hospital. It may feel like a trusted ecosystem combining clinic, hospitality, coaching, diagnostics, recovery, nutrition, sleep, and regenerative wellness. And fifth, wellness is becoming integrated with healthcare. This is the most important trend. Wellness, healthcare. Wellness cannot remain vague. Healthcare cannot remain reactive. The opportunity is to bring the two together, and this is where the future lies.
Yeah. Thank you very much. I think really the paradigm shift of a one size fits all to really just kind of looking at it in these different, I guess, aspects is, I mean, it's here to stay. And I think you've been in a really good position to kind of witness this as a forefront, running the hospital and now, being, involved with many different technologies.
Mhm.
So, yeah, so I really want to thank you, like for sharing your experience and insights. Do you have any like final comments you want to share with the audience before we go?
Right. I just like to say that the future of healthcare must be more accessible, more intelligent, more
Hmm.
preventive,
Hmm.
but most importantly, it still must remain more human. And that is a journey I'm committed to. And that is where I believe healthcare leadership must go.
Wow, that's very profound, especially with your background, as a like senior healthcare leader. So I hope the audience can benefit, and also like future leaders can also like take note. So okay, so I think that's it. Thank you very much, Dr. Tim. It's great to have you, and we'll definitely want to invite you next time for some future episodes, maybe more diving deeper into like the phototherapy, like the robotics, and different topics. Yeah.
Sure, glad
Okay.
and happy to share. Thank you so much.
Hey, thank you. All right, have a good day.
Bye bye.
Bye.